Hey guys, what's up? It's another episode of Me, Her, and Everything Else. And I'm here with one of my faves, actually. She is an esthetician and she's the owner of Breach Aesthetics. Dr. Bea. Hey.
Hello, how are you?
I'm good, thanks. And I also have the manager of Breach Aesthetics. It's Nkechi.
Yes.
Yes, Nkechi. Hi. I actually dragged her onto the show today. You'll find out why in a second. But we've just been bantering about Nigerian politics. It's Nigerian women here with their opinions. I think you should come back so we can have another.
Do something nice about Nigeria. Talk about history of Nigeria.
Yes.
And, try to find out, where Nigeria is heading with this next election coming up.
Yeah, especially because they don't want to really involve Nigerian women in the whole...
it's also a history of Nigerian women and the ones in government and what they have done, and they've disappointed us.
Like some people that have taken some money and used it on some types of bras. Anyway, we'll not get into that. But speaking of Nigerian women, we're going to be talking about beauty. How are we going to do this? You know what? I'm just going to out myself, yeah? Mm-hmm. So there are a lot of women in Nigeria, especially, that have gotten certain procedures done. I'm not talking about booties. This is not that episode, guys. So we'll do that another day. This is more of like facial enhancements to their faces, adjustments, and things like that. And they really just walk around and I didn't do nothing. It's like, you look brighter. Yeah, I've been using a different type of soap. Or I'm using this cream. Or your nose looks, it's the makeup, it's the contour. But Dr. Bea here, he's behind some of your faves, new chins, new noses, new cheekbones, etc., etc. I'm not even gonna lie, guys. I did get some Botox the other day. See? Hallelujah, I feel relieved, to tell the truth. Yeah, I got some Botox in my forehead just because. Yeah, like when I can't even do it now.
When you try to frown and you too much frowning.
Yeah, so. People used to ask me, are you angry? And I got fed up. Like, stop asking me, I'm not angry. But they're like, because you're scowling, you have a scowl. And I'm like, why are you all touching your heads now? It's like, I have a scowl. I'm like, I got fed up. I'm not angry. It's just the way my face is. But Dr. Bea is sorting me out. Yeah, I got some shots in my forehead. I'm good, see now.
So you feel free talking about it now, right?
Yeah, I mean, I don't think it's a big deal. I mean, yeah, it is what it is. Mind you, a lot of your favorite people have done it. Don't let them deceive you.
I don't know.
Dr. Bea she's got NDA, so, she can't really disclose. But, so yeah, people have been doing different types of things. So Dr. Bea's here. She's going to tell us a bit about that. But let's talk about Botox. Mm-hmm. So why is it that women, especially in Nigeria, don't like to say or just be upfront about things like Botox, fillers,
and everything else? So you said about Nigerian women, but the truth about it is all over the world, women are not very comfortable talking about what they do, to achieve a certain, beauty look. Mm-hmm. They just don't want people to know. It's kind of like, let it still be a mystery to them. Why am I getting more beautiful? Why am I getting looking so younger? Why? Let them keep thinking. Even some patients who get, lose weight through gastric bypass, they've lost all the weight. And then people are like, oh, what did you do? They would say, oh, I'm just drinking water and lemon. The thing is working. It's working. And then, you go, you rush, you get the water, you get the lemon, you squeeze, you drink it for like 2 months. You're like, the way she lost weight, I can't lose weight like that. And you're wondering, that's what they want. They want you to still be puzzled because women talk a lot.
Yeah.
And whether we like it or not, it is the truth. I'm a woman, so I know how it is for me to work, and I'm in an environment where I don't get to talk about people. So I have developed that self-control because of the type of work I'm doing. But still, women, generally speaking, talk a lot.
Yeah.
And so if you go tell your friend or your brother or sister or whoever it is you want to tell that, oh, I did this, I did that, they will be happy for you. But when it's time to abuse you, is it because you're looking younger? When we know it's those shots you're getting on your face, fake woman like you, then the problem has started. what if I didn't tell her?
I'd like to retract my statement.
Exactly. And I would have just kept it a mystery.
Yeah.
So people still are very, they're very scared of sharing their secrets because they don't want you to use it against them. It's their life. It's their choice. So why do I have to get to tell somebody? And then that person, I'm not sure if we're going to be friends in the next 5 years or, close in the next 10 years, and you know all my secrets. And then when you want to talk back at me, you say, you use it against me.
Them. Yeah, that's a really good point, and that's very valid, and
so
it's true.
A lot of women out there, even men, are getting these things done on their face. And I was talking to someone a few days back. They asked me the same question, why do people get it? And I said, we are in the digital age where we're no longer seeing ourselves through the eyes of another individual. Everything, we see it on the camera. The phones, they're just showing us all our imperfections, and then you have things like Snapchat, filters.
Oh my gosh, please, can we talk about those filters?
Yes.
Because now, can you safely say that you're addicted?
No, I don't like filters.
You don't? Are you addicted to Nkechi?
Yeah, I'm not. I'm not.
I don't know.
I don't believe you.
Filters.
You're not?
I don't
No,
like.
I'm not.
I'm against filters right now. And I'll tell you why. Because I have worked on my face enough to appreciate my face without a filter. What do filters do? Either they enhance your cheekbones, they make your skin look brighter, they give you a puppy eye or a cat eye, or they enhance your lips or bring out your chin, or make your jawline really slim.
Yeah,
I've done all of that. So if I put a filter on this face, I would look obviously weird.
Right, because it's too much.
It's going to be too much. So I wouldn't want to put a filter on my face. I tell them all the time, I said, stop putting filters on my face. My face is already good
filtered
without a filter.
So would you advise someone to just get what they love about the filters? Would you just say they should just do it to their face?
If you have the money, get me wrong, you might not have the money. You might as well stick with your filters because that's the best you can get. But if you have the money, you can try to work on it now gradually, especially if you're a natural type of person. You don't want people to say, oh, what's going on with your face? Because sometimes these things, they do distort the face, in the first few weeks or months. If you have the money, you can start to work on it slightly because it's so bad these days. You see someone on Instagram or in a picture, they look all glammed up, all filtered up, all good. Oh my God, you're like, I want to grab that girl. Oh my God. And then she shows up on your doorstep. You're like, oh,
catfish.
I know. You're like, what is going on here? Like it literally has happened to me. I saw a patient and, she said, I was the one you were chatting with. And I'm like, okay, I don't think we've chatted before. Because sometimes I do check the pictures, And then I open my phone. I'm like, show me, please. She's like, this me. And I look, I'm like, is this you? And she's like, yeah, I have to filter my face, slim my jawline, do the nose. They doing all kinds of things with the Photoshop. Do. And I'm like, but this is not you. She said, that's why I'm here. I want to look like my picture.
Oh, it's like the reverse.
Yes, I want to look like my picture so I don't have to go somewhere and people will say, this is not you, or you look better in picture than in real person.
Which is that is a bit of an issue.
Yes, it's an issue now. Everybody says you look better in picture than in person.
And that must really affect one's confidence.
Yes.
And then they start
to think, okay, I need to do this. I need to do
exactly.
that. But like I said, you have to look at your profile. It's all about who you are. If you are the kind of work you do, the kind of lifestyle you live, these are the things that helps me to better advise a patient. If, for example, I've had strippers come to the clinic.
You had strippers come to the clinic?
Yes. And, they look all nice in the body, but their face is like zero. And I'm like, okay, so what would you like me to do? They want me to give them that exotic, sexy,
Oh, yeah, like those girls in Atlanta.
Yes, luscious looks, and they have the big booty, but their face is just not it.
It's not matching?
It's not matching.
Oh, no.
So I would say is if because they're strippers, obviously I have to go all out there. I have to, make them look sexy.
But what is sexy? Now, how do we define what sexy is? And why are we saying exotic? Why are we using all these words? Yeah.
Because in our, in this era, exotic or, sexy is, it's more of like when you're so, like a lot of your features are really prominent and, like the lips, it has to come out. I can't use bad words here. It's a podcast.
You can use bad words.
No. But you understand that is what in this society, what we believe exotic and sexy looks like. Maybe in the next 50 years, it will change.
I mean, so talking about lips now, for example, it's so funny because people usually say, okay, for example, Black women, maybe they're just trying to look more Caucasian. They like to slim down their nose. They want to do this. They want to do that. But things have kind of changed where it's now people are living to look like what it is they're telling us is the new beauty standard, which is fuller lips and big bum and big hips, high cheekbones, which is not necessarily pointed nose, which is, okay, let's say that's a Caucasian feature, but big
Fox
lips. Yeah, fox eyes. There's too much going on. Big lips. So having fuller lips is a Black thing. And in school, women or young girls were teased for having big lips, but now it's a thing, right? So,
and then people still say, why would Black women have big lips when we already were born with big lips?
Oh, that's annoying.
Do you understand?
Yeah. Oh, why would you add to it?
Why would you add to it?
Yeah, but why would you add to it?
First of all, Black women have, fuller lips. I wouldn't use big lips, but we have shorter chin.
Okay.
And most times, because we have shorter chin, when you look at them from the from the frontal view, it looks more like their lips are protruding out.
Okay.
If you drop the chin down, the lips look smaller.
Ah.
Yes.
Do Symmetry.
Yes.
Okay.
It's
your face.
Profile balancing.
Okay.
So she had thinner lips.
Yeah, I filled your lips.
Yeah.
Nkechi,
she had.
This is your
okay,
words.
I feel this.
You want to lie here.
My lips.
She had thinner lips.
Very thin.
Very thin lips.
And very small
and very small lips.
Okay.
And when I first saw her, I said, oh my God, it's very rare to see a Black woman with very thin lips. And I said, would you, and even I think she was having issues, one dental issue. They were saying her mouth is like a baby. I'm telling you, it was
I went to do my braces and they were like, I couldn't use the
mouth guard.
The expander or something.
Okay,
that one, I couldn't use it because I couldn't use the one for adults because my lip was too small. So I had to use the one for kids.
Oh, so that's small.
So it was really
small lips were really a thing before.
It was a thing before, but it wasn't bringing out her face.
Oh, okay.
So it wasn't making her look, like she had to use filters to give herself bigger lips.
Okay.
So that it shows more. And then when she puts like lipstick or lip gloss, they will have to overline her lips.
Yeah, I still do that.
So that it can look more defined.
Full.
So I told her, I said, we're going to fill the lips up. We're going to structure the lips, give it a really nice contour so you don't have to overfill your lips with the makeup.
So would you say that, for example, now her filling her lips is not to do with fuller lips being in fashion, but more to do with the symmetry of her face?
Well, I would, to be honest, it would be because of fashion. Because that's what really, is working now. And then we're also in the era of a lot of makeup. So people are still wearing makeup. Like I said, she was overlining her lips. I mean, I just don't get it. You overline the lips. The moment they kiss you, the whole lip gloss is gone. The whole lip gloss is gone. And then you're like, oh my God, your lips are so thin. It's like fake. So because of that, I said, it's better we fill the lips, give it very pouty, smaller lips. You can see it's not too big.
No, it's not too big.
Yeah, it looks really natural.
Thank you.
You're very
and it's cute, right? And so therefore...
Stop having over her lips.
And so I said, and with that, you can see now, she just glosses it up.
Yeah.
She don't need to overline it. It's very subtle.
Okay, fuller lips. Well, I'm coming for you now. I said I'm going to out you now. Okay, so you had some other work the procedures done on your face. Your face looks absolutely amazing. I'm sure it was beautiful before as well. I just want to get into the reasoning behind you having work done on your nose.
Why are you so particular about my nose?
You know I'm particular about your nose because as black women usually tend to have bigger, wider noses, and Caucasian women have pointy, straighter noses with, is this the temple? What's this called again? The bridge. Sorry, yeah. And you know, women, but I've seen that women always complain about their nose, and I think because the nose is such a defining factor of whether you look attractive or not, because if it's, you know, really big, it's just like, whoa, there's a lot going on. And if it's really small, it's like, wait, can't see mouth. So, but why did you decide to get your nose done? And what did it have to do with? Like, just tell us.
Okay. Tell the truth.
Tell the truth, or
I
please.
know.
Please, you're free here. Should we have outed myself? Yes, I have Botox.
But you took it back.
They will not edit it. Don't worry. It's here for life.
Okay. So, while I was growing up, I didn't know about this aesthetics, changing your face, doing a touch up on your face and all. So while I was growing up, I come from a family of 8. My siblings were all having this really nice pointed nose. I was the only one it's not like my nose was not pointed. It was there, but not so defined. So I had a wider ala, yes. So I wanted my nose to look like...
is this. So
no, don't be.
You just have to be honest.
Yes, it was wide, but not that wide.
Was that here?
No,
it was here. It was here.
Okay.
It was wide. Just say it. It was a wider ala.
Okay, it was wide, but not so wide. It was wide, yes. Okay, so I wanted my nose to look like my sister's nose. So it was really pointed and nice. So if you knew me when I was in school, I was always like with Anki. They call me the Anki lady. I'm always like trying to. I just knew, yes, because I knew that little babies, when you give birth to babies, you can like mold. You can like mold them to how you want them to be while you're bathing them, and it works. You can give them these hips and nice shape and all.
Wait, yes. What we've been doing? No, I know the one that they do. They put the dimples in the back.
Yes, you can do those ones.
People pull the child's nose,
and it works.
Doesn't work.
It works. Yes, they give you a very nice shape of head.
Why
nice
do so many people have weird heads then?
But I know.
They don't know how to do it. They didn't do it well.
Do you know what? Let me tell you the truth. I'm sorry, I'm just going from a medical perspective. The dimples at the back is not going to be molded from putting the finger down there. That's the posterior superior iliac spine. If you have it, you have it. If you don't have it, you don't have it. If it's not prominent, it's not prominent. So that just one is like, I don't believe in all those things. And the bum, if you have a bum, if it's hereditary, it's hereditary. If you don't have it, go and do your thingy. If you want to do it at the end of the day, it's your choice. But why is it that we say people are shaping nose? If you don't have the nose, you don't have the nose. You remember the nasal, the shape of the nose is not just from pinching it. It has to do with a definition and a bridge. There must be a cartilage there for it to give you that definition. Not keep pointing it. So you that was doing your nose shaping in school, so what did you get?
I was doing it, and then I don't know if it worked, but I kept
think it worked.
I kept on doing it till I got to the university. So my 200 level, I stopped because I noticed that my friends were really agitated because they'll come close to me and they'll be like, "Is my mouth smelling? Why are you always touching your nose?" and all? So I stopped doing it. And fast forward to later, I didn't know I could change my nose. I didn't know I could like work on my nose. The only issue I had was my skin. I had like there's some issues in my skin when I was in school. So when I was done with school, I was just looking for a dermatologist I could just go to. Let me just find a dermatologist, just test my blood and give me something I can use for my skin because I'm tired. So that was when I met Dr. Bea, and then I now realized that I could work on my nose. Finally, I could make my nose pointed and really nice. So
because you wanted to be like
I wanted, yes.
But was there anyone else, or was there anything anybody said to you that made you also feel like you wanted to get your nose done?
Not really.
No, just the fact
that you wanted to have that pointed nose with everybody
in your family.
Yeah.
Okay, and then you finally got your nose done.
Yes.
Woohoo!
Thank you.
So how did you feel after you had
pain?
Pain? Yes, it was painful after the procedure. During the procedure, it's good.
What exactly did you get done? Sorry.
I got my nose done.
Was it rhinoplasty?
No, so what we did was for her was, okay, so we we decided that we'll use the PDO threads on her.
Okay.
You know, because it's just minimally invasive. It's not like surgery where we have to cut up the whole nose and, you know, join back. So we decided to put threads in her nose. And also, there's a way we can do the threads to actually reduce the width of the nose.
Oh,
yes,
okay.
without necessarily cutting the nose open. So we just use different holes and go into the nose and do the manipulation and bring it together. So she was disturbing me about her nose, and she said, oh my God, if I just get my nose done, I think she never even told me the story. This is the first time I am hearing about the hanky girl. The hanky girl. I never knew, because the way she would come to me in the daytime, oh, Dr. Bea, my nose. And I'm like, I don't see anything wrong with your nose. It's just okay. She would come the next day. Oh, my nose. Look at it again. Look hard. So I decided to, you know, do the nose for her. And I think, honestly, from the day I did it till now, I think she's been more happy. She's been happier. That's the right word. You know, like, I feel like it has boosted her confidence, you know, and she feels, in fact, we worked on her face. She feels more confident. She does nicer videos. And if you go on her Instagram page, she's doing all sorts of videos. Now, you know the worst part? She's been doing videos before now, but those videos were not depicting maybe the kind of person she wanted to. Okay. So now, if you see her videos, it's all like really creative. And I'm like, this is beautiful. Yeah. Because you can see the change.
Yeah, because of the confidence. And you know what? You know, the thing, what I've learned from talking about like things to do with beauty, because I was talking about skin and bleaching the last episode, is that I think it's easy for people who don't have a certain issue to judge or have an opinion. So, for example, like me now, it would be easy for me to be like, oh, but why would you get your nose done? Why would you do that? Well, I don't have a broad nose.
Your nose is perfect.
Yeah,
it's really
I don't have anything. Thank you. I don't have that issue. So it's easy for me to say that. So I'm not walking in those shoes. And I think when it comes to beauty, I think people are really easy to it's easy for them to say, oh, but you shouldn't do your lips. Don't do your lips. But to be honest, if it's giving that person confidence, I mean, I'm not actually opposed to it. I always advocate for to just do it the safe way if you're going to do something.
And moderately,
do, because, you know, there's some people
and then don't overdo it.
Yes, don't overdo it.
And don't look hideous.
She's very happy and very confident.
Yeah, don't. And then just like you said, you don't have a nose issue, but I mean, you went to go do Botox.
Yeah. But that's because of my scowl, Lord. I'm tired of being called, oh, you look angry.
But that's the thing. Yeah. There's some people who don't have that. And then they'll say, oh, why are you doing Botox? Oh my God, it's so... And then people have this misconception about Botox. They don't even know the difference between Botox and fillers.
Please educate.
You know, and they don't even know the difference between the threads when a patient would need a thread. Like, I just left the office and came to you, and, you know, girl came to my office and said, oh, I just want to do my jawline. And I'm like, okay. I said, how do you know? She's like, now this is interesting. So you know what people are doing. She's like, I've done chin lipo, I've done buccal fat removal. Yes. And then I've done lipo on my neck. And she kept listing, and I'm like, oh my God.
That's a lot.
Exactly. And then she says, Dr. Bea, I know that if I get fillers on my jawline will be more defined and I would look better. Truth be told, she was right. This one was right. There are many others that are not right. So when I looked at her face, I said, honestly, I do not like jawline fillers as much. But because I have looked at your face, you don't have any symmetry, no definition, because you've done the buccal fat removal. So it has made your face just out of proportion. Though it looks slimmer, but it's out of proportion. Therefore, I will define your jawline. On this occasion, on another occasion, if I didn't see the necessity for it, I wouldn't have done it. So we ended up doing the jawline definition. She was happy. And we tipped her lips just a tip.
Of course you did. You always get them to add a little bit more, don't you?
You know? Like, oh, so we tipped. No. No, I told her that this is going to... I was like, that lips, you just gotta, you know, like give it the better pout. And she agreed. And we just, you know, gave the lips a little bit of a tip. And she was super happy about her result.
You know what? There's someone that I think they got their jawline done. And I think on using a filter, they kind of look a bit more like, they look a bit crazy.
Yeah.
But then you see them in person, absolutely stunning. And I've actually read comments about this person, and people are just like, oh, it looks crazy. But when I see it, I'm like, I don't understand. What are these people saying? But
the
filter. Back to what you said about the filters,
you can't use filter.
And especially when you're messing with when you're talking about the jawline.
Yeah, you can't do filters. Once you've done your face, I always say stay away from the filters. Maybe just get a good phone with good camera quality. Take nice pictures. I'm sure you'll look good. But the moment you start I don't do Snapchat anymore. Because, every time I put my face on Snapchat, my chin looks like a dagger chin. I'm scared. I'm like, what is going on? I've had and then I go back.
You must have seen people been saying, they've probably been saying that you got dagger chin.
And then I look at myself in the mirror. I'm like, but it's not that bad. What is wrong with this Snapchat? So the other day I went to a party and the lady, oh, Dr. Bea, let's take a picture. Man, I was scared because she just put a selfie on me like that with her own, my chin. Dagger. I'm like, God. The worst part is the filter was good for her. Her face was not it's not like it wasn't chiseled or anything. So yeah, it made her face look slimmer and nice. But man, it made my face look like a cartoon. I was like, please, can't you just use a normal? She said, Dr. Bea, this camera, if I don't put it, how would they know I'm slaying? That's not how you look on normal this thing now. Come to the clinic. Let's take a look at what you need to do. So you don't get to continue using these filters that make you look funny. Because the filters make us, especially those Snapchat filters, we look like all cartoons when you look at it.
And I don't think people even think they look like cartoons. We're so used to it that they just look perfect. Like, oh, this is perfection. Look.
Yeah, because the skin looks good on filter. It's really nice. But the filters that change your jawline or your nose or your lips, they look ridiculous.
Yeah, especially when you've already had work.
When you've already had work on it.
Okay, all right. Well, Nkechi, I'm really happy that you shared this story because I'm sure there's a lot of women out there that would love to do their nose, and they might be, and men too. Okay, producer says, and men too, that would like to get their nose done. And seeing how confident you are now, and hearing from Dr. Bea, I know you're going to help some people make a decision that's right for them. Sure. But is this permanent? What she's done?
Permanent is relative. To explain. So we've done basically most of her fillers on her face are...
Wait, so she has more fillers on her face again?
Yeah.
But it looks...
Yeah, but Nkechi, what have you done again?
Nkechi, tell them what you've done.
Tell us everything you have done, and then we'll ask Dr. Bea what she's done. Okay, everybody just...
You should count them.
Okay, I'm not going to blame you. You work in the clinic. So
yes, if you work with Dr. Bea, basically
I wasn't going to do my forehead that day. And she was like, oh, but Steph, and I was like, oh,
Steph, why did you come to the clinic?
I was following somebody.
Really?
You
didn't come to do anything?
Well, I followed somebody.
And the person now convinced you to do
she convinced me. I said, did you? And you were also doing promo.
No,
you were doing discount now.
It wasn't just that. You said you've done your Botox and
fine, yes, and it didn't work. But I'm not doing it again because
because it didn't work.
Yes, because it didn't work.
So she didn't want to do it again, and I told her that the two reasons why Botox you would do Botox and it wouldn't work on you. One is either because the Botox is old, or two, you weren't the Botox is good, but you weren't given enough dosage. People come with the clinic. I just want baby Botox, just small. It doesn't work like that. If I baby Botox your face, that baby Botox is gonna leave you in 1 to 2 months. Okay. The higher the dose, the more lasting it is. So that was why I said, you know what? Let's do this so you can enjoy the experience. There's no point in doing it. Yeah. And then you complain after a month that you're not appreciating the results.
I really love it, by the way. Look, I've So hard to
No more lines.
I love it. Yeah, I love it. I really love it.
And it's really nice.
Really
yeah,
nice.
it's nice. Yeah.
So,
Okay, go on.
Go on with
your list.
Okay,
For you.
Are you ready?
I'm
Ready.
Okay, so I've okay, so I've defined my jawline.
Okay.
I did a jawline slimming.
Okay.
You did jawline slimming and then you did jawline definition.
Yes.
That's 2.
Mm-hmm.
I'm the one mentioning.
I'm helping you now. You put it as one.
Yes. 2.
Okay, so I also augmented my chin.
Okay.
Chin enhancement.
Okay.
My chin. I enhanced my chin, my nose, my cheekbone, I did fox eyes.
Oh, you did?
Yeah, and see what it's before it was.
I had like a downwards.
see, you can't work with. You can't. I cannot work in your clinic.
You virtually do everything. Okay, so my fox eyes,
cheekbone,
my chin,
jawline slimming,
definition, my nose, my lips.
She's done chemical
count.
peels.
And then peels for my.
She's done a lot of peels on her face.
That's all.
You know.
That's okay.
But if you look at me, you will never. You will never tell because it doesn't
I also
really.
gave her a brow lift, a slight brow lift. You know.
Wait, what have you not done? That's what I should have asked.
She's not done her booty.
You don't do that in your clinic, do you?
I know you said, what has she not done?
Okay, to your face. You've done everything possible under the sun.
I've done everything. I've done my smile and that's all. So.
Yeah, she's done.
Oh yeah, really? Yeah, sets. Yeah, ready for the streets.
So I think I've done everything on my face. Apart from facelifts. I've not done my facelifts yet.
Okay. You've not done it yet? Oh, do you plan to do it?
She doesn't have. She's been haunting me about it. She says she's gonna...
Okay, question. Do you think you might be addicted?
No, I don't think so.
It can be addictive.
No, I'm not
but
addicted.
you see, because of the kind of person that I am, I know when to say no. Do you understand? So even when they come up with different proposals, like, you didn't tell her. Okay, we'll not say that one. We'll not say that one. The one we did.
No, I've just done my face.
No, it's okay.
So the thing is, I try to control them, or even my patients when they come in. Like I said, I profile you first. So the moment I profile you, I know exactly what we can do and we cannot do. So when they come back and say, oh my God, Dr. B, I just saw that person. I say, stop. Let's retrace your steps. Remember who you are. Remember you can't be like this. Remember people can't view you this way. So this is a no for you, a no for you, and a no for you. So that they don't overdo it. Because yes, sometimes it can be addictive.
Right. There's one procedure I'm interested to know if you actually do this in your clinic. I know there are men in here, but they're grown-up men. Aren't you all grown-up men? Yes, you are. Okay, so there is this procedure that you can do with the labia. Is it the labia minora? Minora. Yeah. So it's where you can actually reduce it so it's not as long.
Is it for the men? Or
for the women. Oh, wait, hold on. Men can get this. Men have labias?
You mentioned men in the first place. I was wondering.
I mentioned it because men can just be like, oh, what's going on here?
So that's a labiaplasty.
A labiaplasty, okay. Because I've seen people
where you can shorten the labia.
Yeah.
It can be an in-office procedure or it can be in the theater where you can actually cut the labia, and that is the majora.
Okay.
The labia majora. You can cut it and make it smaller, you know. And also, apart from labiaplasty, you can also enhance the labia to make it fuller. And we can cut to make it smaller. Because sometimes there's excess skin or wrinkles around there. You know, the vagina actually gets wrinkled. So we do a lot of sexual dysfunction treatments also. So you have your labiaplasty, you have the thermiver, you have O-shot, G-shot. You also, for men, you can also get the P-shot.
Wait, what's the P-shot?
That one.
Wait, hold up. So you can get the P-shot.
Yeah, you can get the P-shot.
Is that to enlarge the P?
So no. The P-shot is to increase the lubrication during sexual pleasure for men.
Oh.
You can also increase the gland. That's the shaft of the
Oh, yeah, the shaft of the... Yeah.
You know. You can also increase it and make it wider and fatter.
Right.
Yeah, so I've done a couple of those.
I was just going to ask you. You've done a...
Yes.
Really?
Yes.
Are these men married?
Yes. No.
They're not married?
No.
Just have girls.
But the short, a lot of married men still get it done. Yeah.
Oh, okay.
And then there's this new one, but it's called Scrotox.
Okay.
Where we put Botox in the scrotum to make the scrotum look apparently bigger and less wrinkled. So therefore, when they wear their trouser, they look like they got, packed
a
down
lot going
in there.
on.
Yes. It's called Scrotox.
Okay. Have you done any procedures yet?
Yes. So so what you don't know is they won't tell you that they're doing this.
Yeah, of course not. These men would never tell.
These men will never tell you. And these women will also never tell you they're getting a lot of work done down there because, they say sex sells.
Yeah.
So a lot of people still want to work on their sexual function, but it's not very popular. It's just for the few who know about it. And then they call you up and say, oh, Dr. B, do you do this? And I'm like, yes. Oh, I'm coming. And they want to get it done. I did it in the UK or I did it in America. And I really enjoyed the, results and I want to, get it done again.
I bet you're going to have a lot of people calling you about that now.
So there's a lot of treatments for sexual dysfunction.
Okay.
And it depends on if you're a sex kind of person. Yeah. Then you can tilt towards that.
Yeah, I love the way all the men in the room are just like up in the air, looking at the ceiling.
You look so happy about it.
I look so happy about it. Because you know what? I feel like for once, now, because they're always going on about women adjusting things. For once, it's like, okay, yes.
Men are also doing things.
Men actually feel insecure or feel a certain type of way about certain things and they see they can actually get it fixed or whatever, and they're like, okay, I'll do this. Because a lot of men love to judge women and say, see them, they just go and get their boobs done, their bum done, their face. This one is doing fake. Yeah, they're fake. Meanwhile, down there, some of them,
but it's still few men
down there. They're also doing their faces.
Oh gosh,
and it's still. And the thing is that I say men can take pain as good as the women. So most of the patients that I have that scream a lot are men.
I love you.
You have to just say that.
Yes, say it again. Yes, most of them are the men that scream a lot.
So sometimes you come into my clinic, you're hearing, and then I'm like, what is going on? Maybe they're just, and you check the room, you see a man. You're like, oh, okay, sorry, sir. It's not going to be that painful. So they're not used to it yet. And that's one of the main reasons why they don't come, because of pain. They feel women are already used to pain, childbirth, emotional pain, all kinds of pain. Women are
heartbreak, breakfast pain.
Mm-hmm. So they can take it, But these days, like I said, we are in a very, like the digital era.
Yeah.
More men are coming out, they want to look good. And men don't age as fast as women.
Right. Mm-hmm.
So more men are coming out to fix their smile lines, fix their nose,
wrinkles.
Thank you so much.
I
want to say something. Okay, so I wanted to let people know that when you think about injectables or aesthetic procedures, don't just think, oh, it's going to change my face. It's going to change how I look. It's going to change me. I still look the same, but better. Exactly. So you don't have to think. Most people, when they hear Dr. B or aesthetics, they just think, no, I don't want to go there. I don't want to change my face. I don't want to change how I look. But you don't have to see it that way. You don't have to want to change how you look for you to consider aesthetic procedures.
Right.
Little tweak here and there can make you look
like
really better. Just nice enhancements can make you look more rejuvenated, make you look better and younger. I mean, our face changes every day. As you grow, the more you grow older, your face changes. Do you get? So would you rather want your face to change this other way, like not really good, or you want your face to change for better, look younger and really nice? Which do you want?
Yeah.
Everybody wants to look better.
I want to look younger. I mean, there's some aunties that are looking very fly, and I've got like one eye open, like auntie.
At 60, right?
Exactly.
60,
so
70 auntie.
Everything changes.
And you
so
see all these American
good.
celebrities, and some of them are 60.
Yeah, everyone's like, oh my gosh, black doesn't crack.
It's orange and what? Lemon
I know
and
Botox
water.
is one thing you can do and lie about. Nobody will ever tell you do Botox.
Yeah,
It's one procedure you can do and lie confidently. I don't do anything.
Yeah,
So
like me,
nobody will ever
I don't do anything.
Like me, I've never done Botox.
Me too.
I've
Never done anything. Thank you so much, guys. And thank you so much, Dr.
I enjoyed it.
Thank you. I hope you guys enjoyed it at home as well. Don't forget to follow us and follow Dr. Bea. Dr. Bea, what's your handle and the clinic's handle?
At I am Dr. Bea is my handle, and the clinic's handle is at Breach Aesthetics.
Okay. And Nkechi, do you want something?
I am Caris __ I am Caris. Please, guys.
Okay, we'll put it in the tag. We'll put it on the video because I'm sure some people want to ask you some questions.
Yeah, I think it'll be nice.
Okay. Thank you guys. So we'll see you on another episode of Me, Her, and Everything Else. Bye.